All right. Welcome back. Hour number 2. Stem cells. Stem cells. Not a hot topic in the news like it was. And there are several reasons for that. But most importantly, we're beginning to see now a clear definition between the ethical, proper, effective, intelligent use of certain types of stem cells and the alternate. There are a lot of people who are desperate out there, and when you have desperate people with a little bit of money, even some with borrowed money, and you have people who don't have the ethics that we'd like to see, you have a formula for people getting hurt in many ways, including losing even more of their health. That is no longer an issue. Dr. John Trowbridge, MD, as a personal friend of mine for some time now, a number of years, and John he dove into the stem cell thing in the beginning to find out what the truth was, what's really going on. And he has found it. He has a practice that deals in stem cells the same way that you or I would select and choose to have stem cells used on us, if we had all the knowledge and information. It's the only organization I know of, his practice, where I would feel 110% confident. There was just a horror story recently. 2 quacks were using, I won't name names, 2 quacks were using, these weren't MDs, using stem cells. I think it was a Florida location, and they injected some woman who was suffering from, I think it was macular degeneracy, and they gave her stem cells in both eyes. She went blind almost immediately. She's blind. So the madness out there has got to be anticipated, and I know all of you listening would want to do your research. Well, that research has been done for you. Dr. Trowbridge is the man in America, in my view now. Dr. John, welcome back. Thanks for being here.
Jeff, what a pleasure to join you again. And this situation in Florida, there were actually 2 more. There were a total of 3 patients blinded in that same office.
Oh no!
And
these weren't MDs doing this.
No, and the patients don't sign. And I know you're going to blind me. That'd be a consent.
I mean, I just can't. I mean, come on. Injecting stem cells into eyeballs. Okay. Anyhow, whatever. Tell us how you're doing. How's your practice? How are you doing? People are. I would imagine you're awfully busy now.
Well, yes, Jeff, and I'm happy to report we weathered another serious storm, tropical storm Imelda here in Houston.
Oh yeah.
And although happily my office and home were once again spared, like from Hurricane Harvey 2 years ago, there's just too many people with too much devastation. And of course, that's material that we've covered, 33 years ago in my book, The Syndrome. And I updated that last year with a volume called Sick and Tired. And what bothers me, there's actually a chapter in Sick and Tired called Hurricane Hell 2022, because that's when a lot of the illnesses are going to start to show up from the flooding experiences. So,
of course. Yeah.
We've got our mindset busy on helping people who don't understand how sick they're going to get. And, that's one of the problems, Jeff, with stem cells, is you think, oh, I can just take care of this with medications over the counter or prescription or whatever. And then, you finally end up getting cortisone shots or maybe rooster comb, chicken comb. And at some point someone says, you're really going to have surgery. They don't hear the other alternatives. And when you look for options that you might have, like you say, some of it might not be a completely honest presentation.
No, you're understating it like the gentleman you are. Look, some of it is outright hucksterism, and the alleged doctors, some may be doctors, they know it's not going to work. What I guess they think is that in many cases it won't work and the patient will just go away, and you can tell the patient, well, in your case it just didn't help, sorry. but you got to pay your bill anyway. I mean, it's just,
Jeff,
oh.
I have to tell you, Jeff, sometimes they say, well, you need more. You need another set and a third set. You know, most of our patients are one and done because we're very careful who we select and offer the treatment to. And I spend most of my time actually talking people out of it because we have other equally effective, much less expensive programs that can produce the result they're after. They need to get out of their pain and get on with their life.
See, that's called ethics, ladies and gentlemen. All right? It's too easy. You use the highest quality stem cell in your protocols. Tell us how thoroughly clean they are, how sourced they are, how well sourced they are. Give us that again. I remember a little bit from last time.
Sure. Jeff, the story is that a lot of things that are promoted as stem cells are not. Now, I'd like to say that it's because the doctors are simply mistaken, but I think some of them are direct misrepresentations. You need to understand what a stem cell is. It's simply the little packet of cells that's in all the tissues of your body, waiting kind of like the National Guard to be called up in case they're needed to help them healing, okay? So when you have an operation, your skin doesn't heal side to side. The stem cells heal the skin right there. And this happens all over your body constantly. You're doing repair until you get older, of course, and there's less repair because after the age of 30, you dramatically lose stem cell potential. Now, the key is...
In other words, the body... Hold on, John. The body stops producing stem cells after 30, 35? Is that it? Kind of like the decline in HGH production in the body? It just begins to slow down.
Well, we're not sure exactly where they go, but there's always much less, and they are less active, less able. And so you've got a double whammy going on there.
Yeah.
And so the cells that we choose are, brand new baby cells, but not from the baby. Now, that's kind of fun because it's actually from the cord blood after a scheduled C-section delivery in volunteer mothers, okay? The cord and the placenta are discarded. Well, there's some valuable stuff in there, and our patients are very carefully pre-selected in Utah. This is not from overseas somewhere, some skanky hospital somewhere. They are pre-selected, and within hours, the sample is in the laboratory in Utah, and the nice thing about it is, they've got the mother's blood again, and now they've got the baby's blood, and they prepare everything. They go through all the steps, but put everything into quarantine for 2 or more weeks while the retesting is completed to make sure that the sample doesn't have any question associated with it. And this lab has been doing cord stem cell processing and preserving for many years under...
But they were one of the pioneers. Yeah.
These guys have been doing it well. And the nice news about it, I have to tell you right off, and I'm sure you remember this, these are the ones I use for me. So that's a real testimonial is I trust this on me.
Yep. This is a... go ahead.
Well, they come to us fresh frozen. I mean, they've been preserved, and they test viability on each batch so that they know what's going on. They come to us, they're frozen until literally 5 or 10 minutes before we inject them into the patient's joint. And it's about as crisp and clean and active as you can get.
Very good. You mentioned rooster comb.
Yeah.
Is that where some people are sourcing what they call stem cells from another species of animal? Is that what I'm hearing?
This is an orthopedic treatment that people use because they say, this is just wonderful stuff. We can inject it. Your knee has wear and tear, osteoarthritis, and we can shoot in this sticky rooster comb, and it serves as a padding between the bones, so it's much more comfortable. You can only do that roughly 3 times or so because you can develop allergy reaction to it and such. And there's limited
I was going to
use.
say, wouldn't the body begin to reject that?
Well, your body's a lot smarter than a lot of people and a lot of doctors give it credit for. It figures things out.
Uh-huh. Uh-huh.
And I don't care if people have had the rooster comb, but they sure delayed and wasted their time and their money on the way.
Wow. Interesting. Okay, what are the most common stem cell therapies that you employ in your practice? What are people coming to you for? You've done a lot of work with orthopedic protocols before. What are you doing with the stem cells most commonly?
Since 1990, Jeff, I've been using prolotherapy, which is the injection into and around a joint of a natural substance that causes proliferation, hence prolotherapy, or rebuilding of the joint tissues. And so I've been doing that for, 29 years. And the neat thing is you can make a tremendous amount of repair happen by stimulating your body's stem cells there. But remember, you're older, you're injured, they are less numbers and less capable. And when we inject the stem cells instead of the prolotherapy solution, you get a tremendous blast for healing right away. Like I say, most of our patients are one and done. And the reason is because we select you carefully. We put you on nutrition associated with doing the healing. We have a variety of techniques in the office that stimulate the maximal repair from the stem cells that we inject. We have wonderful success in the right selected patients. We're kind of picky about that.
Well, this is important. It's not for everyone. And
correct.
It's too easy for a doctor to say it's a universal application. Stem cells are good for everyone in one way or another. But that's not true necessarily. Not
true. If you can do something easier, why use a sledgehammer when you can use a fly swatter?
Very good. Very good. All right. Now, we have standing by here several people who have been patients of yours, and I want to bring them on. And I think Bob is on first. Let's see. You want to introduce Bob for us, Dr. Trowbridge?
Well, I talked with, this is Rob, and I talked with Rob actually several months before, he made the decision to come for stem cells. He has had hip pains for years. This is a very athletic man, he'll tell you. And this starts taking you down in the middle of your adult years. When you're not used to it, you're not expecting it, nobody seems to help. And when I first talked with him, I said, get me your x-rays. And he did. And I said, looks to me like this would be something that would help you. We're going to have to give you a kind of a big dose, but hopefully one set will be enough. And he'll tell you his results. It's been kind of fun.
Okay. Very good. Rob, are you there?
I am. Very nice to meet you, Jeff, and great to hear your voice, Dr. T.
Hey, thanks, Rob.
Thanks for being on, Rob. How did you first find Dr. Trowbridge, and then tell us about your acclimatization to stem cells. What got you interested in that?
Well, what got me interested in stem cells was Dr. Trowbridge. He gave me his book, and I read it, and I was absolutely fascinated by it. And at the time, I was really looking for a solution. I mean, my hips were killing me. And as Dr. T said, he looked at my x-rays and he said, maybe you should reconsider that bilateral hip replacement you're considering and take a look at stem cells. So I did.
So they were telling you needed a new hip. That was the general recommendation.
Absolutely, Jeff. And they were ready to do the operation.
Oh, I'll bet they were. Yeah. So what were you doing in life? What kind of athletics and vigorous physical things were you doing and you say your hip was really killing you. That's not good. We're talking about on a scale of 10, what's your average pain, or what did it used to be?
Well, I'll tell you what, I'd say average pain was probably up there in the 6 or 7 range and climbing.
Well, that's incapacitating. I don't know how you could do anything like that. I understand that. I understand pain.
Yeah, it was pretty tough. And I'm not one to take medication. I'm telling you, I won't do it unless I absolutely positively have to because I can't stand it anymore. But I sure was getting close. These hips were killing me.
What were you doing? What was your most fun thing that you liked to do?
You mean that led to my hip dysfunction and pain?
Yes.
Well,
I don't think it wasn't hanging drywall. We know that. So what was it?
No, I had actually been a professional martial artist. I started doing martial arts at the age of 15, and I did it until the age of 42. So during that 27-year period, I did it at a very, very high level. I was a semi-professional kickboxer. I was breaking baseball bats with my shin bone. I was flying through the air, breaking boards, and I did it for a living. So I beat my hips up much more than the average guy. But I think what really complemented the problem was that I had hip dysfunction from the time I was born. When I was 10, I broke my femur bone. And somewhere along the way, I was medically misdiagnosed for a leg length discrepancy, and the doctors put me in a heel lift, which led to a shoe buildup. And the buildup somehow kept getting larger and larger and larger over the years. And as time went by, all of these things contributed to massive hip pain, degeneration in my hip joints, arthritis. And when I got into my 40s, man, it all kicked in.
How sad that that would happen to you. When someone is so deeply involved in martial arts, I understand that becomes it's a part of your philosophy of life. It's the way you live and the way you think in many ways. So that's a tough
you're
loss.
Right about that. Mm-hmm.
All right. So
you're right about that.
Somehow you found Dr. T. Tell us what happened then.
Well, Dr. T suggested that I take a look at stem cells, and I was willing to try anything. In fact, I had tried a number of things. I had tried prolotherapy, and I had tried chiropractic, and I had tried physical therapy and so forth. So, I was really holding out. Some people can't wait to go in and get a hip replacement. I mean, I was not one of those people.
That's not a joke. Hip, knees. No. Oh, yeah, there's a line around the block for it now.
No question about it. And I'm not one of those people. I want to keep my own parts, and I want to keep them as long as I possibly can. So Dr. T suggested I take a look at the stem cells. And I got to be honest with you, I was skeptical. It had nothing to do with Dr. T. I mean, he's a man of supreme integrity, and he's wonderfully charismatic, and he has a big heart. It wasn't him. It was just that it sounded too good to be true. You come in, you get a couple stem cell injections, and maybe your problem goes away. Yeah, I was a skeptic, but I went through it, and it was one of the best decisions I've ever made.
How long did it take to see results?
Well, the results were almost immediate. And I went into Dr. T's office, which, by the way, the entire staff there made me feel so comfortable and at home. They literally treated me like family. It was amazing. It was so different than going to a typical doctor's office or dentist's office where you just feel like one of the many cattle that they're shuffling in and out of there. I felt totally different. They brought me into the room, met with Dr. T for quite a while. He went through everything with me from A to Z, made me again feel very comfortable. And then when it came time to do the injections, it was almost surreal because months had gone by where I was looking forward to this and pondering it and wondering how this was going to go. And then the moment arrived. He had the syringe in his hand. It was loaded with stem cells. And he was so precise with the injection on that first one. Went directly into the joint. He administered the injection, and hip one was over. And then in a flash, he did the second hip, and it was done. It was an interesting sensation. My hips joints filled up with the stem cell fluid, and we were done. It was literally that quick.
And you walked out of the office feeling better, literally.
Well, I walked out of the office feeling awkward, a little bit. It was a little bit of an odd sensation. And I remember when I got to the airport, this airport, I had to do some walking to get to my gate. And I remember it was weird, because my hip joints, my butt cheeks, basically back in there, it felt like it was filled with fluid, and I couldn't control my gait very well. So I got on the plane, went home back to Florida, and went to bed. And the next day I woke up, and this is the really interesting part. So the next day I had this state of bliss I felt. It was really weird. My legs, my hips, they felt almost like heavenly. I felt like a calm, peaceful, relaxed sensation that was truly incomparable to anything else I've ever experienced. And I was astonished. I think that day I called Dr. T's office and spoke with his assistant, Kathy, and I said, what was in that stem cell concoction? Was there some kind of a numbing agent or Novocaine in there or something? He said, nope. I couldn't believe it. But it just took the pain away. So from that point forward, and I don't know about others, but I'm speaking about me, that scratchy, burning, rickety feeling that I felt in my hip joints was basically gone.
What a great story. Wow. Hold on, Rob, if you would. I want to come back and wrap this up. We've got two more people to talk to in our next half hour. Dr. John, this has to make you feel, every success like this, I don't know how you can put it into words. It's got to make you feel really wonderful.
Jeff, you and I have talked about the ways in which you have impacted lives around the world with your program and your website. And in my small way, I have had the privilege and the pleasure to impact incredible patients who suffered and had risky proposals for their surgery and not needed it. And it's a blast.
Wow. Well, good for you. And I want to say, as we slide into the break here, that after the attempt to, it was an attempted assassination is what it was, on me 4 years ago, Dr. John, with no request on my behalf, stepped up and sent me all kinds of wonderful supplements and offered his help and his assistance, and that's very special. So I appreciate that, John, very much. I just want you to know that.
It's a privilege, Jeff. I mean, my thought is keep everybody who can be helping people going as long as they can. And my patients are wonderful. They make great contributions when they feel better.
You bet. Okay. Hold on. We'll be right back with Dr. John Trowbridge, MD, and Rob. All right. Welcome back. Talking about stem cells. Dr. John Trowbridge, MD, and click under John's name. You'll go to his website. We're finishing up with Rob here. Let's wrap this up, Rob. How would you like to end this remarkable little presentation you've made?
Well, what I would say is that when you boil it down to its essence, I went in to Dr. Trowbridge with rickety, scratchy feeling, stiff hips that were throwing off heat. And when I came out, my hips, I wouldn't say they felt as good as new. I think that might be an overstatement. But I think the pain has been reduced by at least, I'm telling you, at least 90%. And I still have my own hip joints. So it's miraculous. I would also add to this that I had this procedure in October of last year. So we're just at about a year. Yeah. My hips still feel great. My colleague, who works at the same company that I work at, she had her shoulder done by Dr. T, I think the day before, the day after I had mine done a year ago. And I spoke with her in person about a week ago when we were together for an event, and I asked her how her shoulder was doing, and she said, unbelievable, it's a miracle. She raised her hand in the air and started making circles with her arm. She said the pain is gone and the range of motion is back. So, if you're considering hip replacement, shoulder replacement, knee replacement, before you do that, you might want to talk to Dr. T. It might be the smartest thing that you can do.
Thank you, Rob. We got 2 for 1 out of you tonight. Good. Well done.
You're welcome.
Thank you very much.
Pleasure.
All right. You take care. Thanks.
Okay, gentlemen. Thank you.
All right. Let's run right over to our next guest and say hello to Barry. Where are you from, Barry? Where are you calling from? Or where are we calling you?
Call from Walden in Montgomery, Texas, sir.
Okay. Very good. Tell us about your story with Dr. Trowbridge and stem cells, please. What was the nature of your illness or your discomfort, shall we say?
Well, good evening, sir, and good evening, Dr. Trowbridge. My problem mainly was with my shoulders. I had some rock climbing accidents, parachute accidents, and other military and government-related problems, to the point where I couldn't raise my arms, but about halfway up toward my head. And
Both
I
arms.
looked into, and I'd already had my knees replaced, and I had some couple surgeries on broken wrists and some other.
You've never led a
injuries.
life of a couch potato, have you, Barry?
No, it's been interesting, but I wouldn't give it up or do it different now or any time. So
sounds like you might have been doing some, let's just say, very interesting work for certain areas of the government too, at one time or another.
Well, yeah, I did. I'm from the old underwater demolition team, men and SEAL team, Vietnam era SEAL team. So
got it. Well,
it was a lot of stress on the body, a lot of physical stress on the body.
To put it mildly, you guys were supermen. I don't know how you do some of the things that SEALs and underwater demo guys do.
I appreciate that. But, I went. I looked into the. Like I said, I had both knees replaced, and then they wanted to replace both shoulders. And I was at that point. I said, "Well, I'm going to start speaking to people about how their shoulder operations are coming along, and what kind of luck they had." And I wasn't satisfied with what I was hearing. So I had spoken with a friend of mine who was seeing Dr. Trowbridge before I was, and I was amazed how well he was doing, and he gave me all the information about Dr. Trowbridge. So my wife, she's the computer lady, and she looked up everything and got some of the recordings, and we talked about it, and I finally made an appointment and went to Dr. Trowbridge, and I had the injections in both shoulders. And I guess one thing I want to say, so I don't forget, the amazing thing was, my shoulders are feeling better, but I've had problems with my hands and fingers because I've broke some wrists, I've broken fingers, and I had arthritis in both hands and fingers to the point where I could hardly make a fist. And it was amazing to me that the first thing that the stem cells helped was the arthritis in my hands. I mean, just all of a sudden, like within a couple weeks, I was wiggling my hands and just doing things with my fingers and waking up in the morning and didn't have to, just keep wiggling my hands and get them where I could do things with them. But that's the first thing that the stem cells actually did besides helping the shoulders. And that was a real surprise to me. So I was very happy about that.
Very nice. The process, one injection each shoulder, like we heard from Rob?
Yes, sir. Yes, sir. And
when Dr. Trowbridge was explaining this to you, did you have a feeling of kind of, this is too good to be true? How did you take it? Look, let's be honest. You were living a life of pain and just misery some of the time. I can tell. And you're not a complainer. You're an American hero. You're a patriot. I got that. So did you feel and I would expect you to, a certain amount of honest skepticism about this before you did it. You had to.
I did a little bit. I didn't want to. I guess mainly I didn't want to waste the money on something that I wasn't real sure about. But that's why I did research, and my wife did a lot of research into the stem. Not only all different kinds of people were doing stem cells, but of course Dr. Trowbridge. But Dr. Trowbridge puts out all this information. I mean, the doctor is he's up forward about everything, and he's a pleasure to talk to. Like Bob was saying, the doctor is a real pleasure to talk to. He makes you feel, he relaxes you. He just, he speaks your language, and he speaks my language. And I just really, and I'm not I've never been big with doctors. I don't like so much to take medication, go to doctors.
Sure.
But with Dr. Trowbridge, he's an easy doctor to talk to, and I still see him. And so he's on my doctor list now.
Very good.
I do see him, and that's unusual for me. But
how long has it been since the treatment in the shoulders? How long now?
I would say almost a year. It's been probably a couple months short of a year. And the shoulders are doing well. I can, before I was starting to get to the point where I couldn't even wash my hair. I had a hard time. I had to lean my neck over or bend over to wash my hair and get my hands up far enough to even wash my hair. Now I can, I can raise my hands. I can wash my hair. I just can do a lot more things. I'm getting, I'm about 99%, and I'm with how, I can go out in the yard now and work out in the yard. And I'm feeling about 99%. And that was after I was treated for prostate cancer. So I had that issue too. So.
Right. Well, I'm really happy to hear this, Barry. I imagine you've told about as many people as you can tell how this has benefited you, I would think.
Yes, sir. I do. And a lot of people asked if they knew I had the stem cell treatment, and I'd flat tell them, I said, well, if you can do it and you're a candidate, I would definitely look into the stem cells before you start having all these operations. So
Very good. Very good.
Seems it worked for all of them. It worked for me. I show them what it's done for me, and they seem very happy about it. So.
Well, I'm happy hearing about it. I'm sure
a lot more customers.
Yeah. A lot of people out there need to hear things like this, and you're sharing things that will help, I think, a lot of people. So thank you very much, Barry, for that. I appreciate you coming on tonight. Thank you.
Thank you, sir.
All righty. Okay, we have one more individual to get to. Dr. Trowbridge, a comment or two here. What wonderful people you get to treat as a physician. These are nice people, good people.
Great, and the neat thing about these guys, they're not overstating the degree of limitation and discomfort they were having. Barry did a lot of wonderful things for our country, but that takes a toll on your body. And Rob did some incredible things teaching martial arts and displaying what an incredible, gymnastic form that is. And they were paying for it and not, looking at golden years being so golden, but much more rusting. And we can help that. Even if it's not stem cells, we can do other technologies that can make an incredible difference. People simply don't know. Our slogan is, the website is healthchoicesnow.com, because if you don't know you have health choices now, you don't have any.
True. All true. All right. Let's go to our next special guest, and he is Barry, and I think he's standing by right now. No, he's Rick. Rick, it's your turn. Are you there?
Can you hear me okay?
We got you now. Okay, very good. Thank you, Rick. Thanks for being here. So tell us your story about stem cells and Dr. Trowbridge. How did this all start? What was the problem, and how did we address it?
Well, good evening.
Good evening.
Your two first guests were well spoken. It's gonna be hard to follow up on that. But moving on is my story is kind of simple. I was a quarterback in high school. I played a lifetime of sports, but the first injury came as a quarterback, and the play was called dead as I was back for a pass, and the defensive end never heard it, and he came in and head first, which we called a spear, and he speared me right straight to the hip, and my hip just went on fire, and I had to go down to the turf with that hit. I just couldn't even stay up on it, and so that was a lifetime injury. It nagged me through the military and through all the other different sports that I played through the years, and
that's an illegal hit. Now you can't do that anymore. The NFL outlawed that years ago. I don't know how common it still is. Those people are crazy. You can break your neck doing that. Never mind hurting other people.
And back then we were taught to hit with our head, so it was almost like the common thing to do. But there was a penalty to that. That's a flag, and so. But
you got flagged for life. That's the other problem.
Yeah.
So.
Correct. But here in the later life now, my wife and I walk around the block, or we walk however far we're going to walk each night, and it got to the point where I couldn't make it anymore. I'd fall short, couldn't make it back to the house. I have to stop and try to shake it off. Wow. And I was already seeing Dr. Trowbridge. He was fixing other things, and told him the problem, so I just couldn't go no more. And we started a couple of treatments of RT, prolotherapy, I call it RT, and I was getting benefits from that, but I kind of was looking for something to move ahead a little bit faster, and he'd been talking to me about stem cell, and so I simply ordered it, and he simply administered the stem cell, which was like your earlier guest, it was really not a big deal.
Mm-hmm.
And I can't put my finger on how long it took, but I'd say a couple of weeks, and I was walking around the block with that without really wasn't noticing pain. I'd get a little bit, but it was pretty much gone away. And I would say 3-4 years now, maybe 3 years. I'm still walking that walk, and it just 90% it's healed.
So nice thing about this, it's not a maintenance kind of a procedure. One and gone. That's it. It works, and you're stable. That's the part that amazes me. You don't have to keep going back in every 6 months for another round of injections.
And that's correct. I kind of.
Dr. T, go ahead. What?
Rick needs to tell you about his hay baler.
Yeah. I followed up with a wipe out on a hay wagon, and put a little bit of a torque to it, and
torque to what?
A little touch up to the hip and the knee, actually, and
okay.
That I was already having knee trouble anyway, and so we went for another round of stem cell, and he put one little hit to the hip, and then the rest of the shot to the knee, and then it was game over for that. So it's
amazing. It's just incredible to hear this. What did your wife say?
She's happy because if you're not in pain, you're a happier person. For one.
That's a really important thing you just mentioned. Pain does a lot of damage to people in ways that many of them don't even think about. Changes your personality. It can change your attitude. Can change the words you choose in conversations. It keeps you awake. It can demean your whole baseline immunological system because you don't feel good enough to eat right, do things right. It's a lot of disease and discomfort is mental. You all know this. I'm just going through the basics here. But you said that, and it's very important. You feel better. You have your quality of life it can zoom. And what wife wants to walk around the block alone? I agree.
Correct.
Okay.
But
anything you want to add to that?
That's pretty much my story.
That's a great. Well, that's a great one. Yeah.
My only other little small add is that in my own mind that if you're getting a stem cell shot for an injury, is what other things is it fixing that you don't know about? Other small injuries, other little things. What could that stem cell shot be doing?
Well, Barry mentioned that his hands were feeling better. Yes.
Correct.
He didn't get treated in his hands. So this sounds like a very broad brush approach to doing a lot of good things for the body. Thank you, Rick, very much for coming on tonight. Thank you. It was well done.
Good talking to you.
Okay. Dr. Trowbridge, you must sleep pretty well at night, I would think. You're doing some wonderful things for these people.
Oh, gosh, Jeff, people ask me, I've been around. I've got a good 41 years of experience so far. And people ask, well, when are you going to retire? And I can't think of a good reason why I should.
No.
I'm having too much fun.
You're just into a whole new realm of amazing achievement here. This is remarkable. Let me just ask you in general terms, where is correct stem cell therapy right now? It's in its early years, if not still its late infancy, isn't it?
Oh gosh, yes. There's wonderful research going on at the universities, and when you talk about, I've heard about this and that, these diseases and whatever, the research is going on in several places. Okay. Now, in the real world of patients and getting them better, joint improvement with stem cell treatment in the proper patient and managed the right way can be absolutely stunningly successful. But that's the early deployment of this technology into the patient world. Things are coming, but the real key is you have got to have, conscientious people doing ethical things. And that's starting to get weeded out. The federal government is starting to come after folks who are not quite doing it the right way. And that's good news.
Wow. Amazing. When you have such success, I imagine word travels pretty fast. And are you being asked to give presentations at conferences, orthopedic surgeon conferences, whatever, to share what you're doing?
Oh gosh, no. It's kind of funny. I have been on the bleeding edge of advancements in medicine since just after my first year in medical practice. And what I have found out is that, the old story that a pioneer has arrows in his front and bullets in his back. And
yes.
It's fascinating that a lot of people just don't want to hear. Now, I have coached over 36 doctors who are interested and competent and capable. I've coached them on how to do it my way. And that's been a great happiness to me because, if they can kind of get the leading edge from me and start out doing it even better, they get wonderful results. And that's been exciting to have them call and say, hey, listen, I got this patient who had this problem, and they're doing so great, and thank you so much. That's wonderfully reassuring that there is a future that can develop from all of this.
It sounds to me like this may be perceived by the orthopedic surgeons who specialize in joint replacement work as a threat to their world. Is you get any of that idea? Is that there?
Some of them do. Others really are looking at the world. Kind of like when the automobile came along, we weren't going to need buggies and buggy whips as much anymore. Like we used. And people have to adjust to the technology that can produce better results. And I still refer people to surgery. I've got great surgeons that I send to, and sometimes I'll tell a patient, now listen, if you talk with them, they might not be complimentary about me because they don't necessarily like what I do, but I've been sending patients to them for years, and I like what they do, and that's what you need right now.
Well, that's called integrity, which you have always demonstrated. Thank you for all you're doing, and there'll come eventually a tipping point where proper stem cell research, and you will have been the man who's pushing it, will be accepted, I think, on a very broad front, and I hope that comes soon. Thank you very much, John, for everything you do and for being here tonight. It's always great to talk to you.
Thanks, Jeff. We invite anyone to call 1-800-FIX-PAIN and get more details.
All right, that's real simple. 1-800-FIX-PAIN. All right, 1-800-FIX-PAIN. And it's an easy flight. Tell them where your offices are located again.
You know, Jeff, we're right next to the Intercontinental Airport in Houston. It's a short ride, and we have people who come in, get their treatment, and leave.
There you go. All right. John, we'll talk again. You be well. Take care.
Thanks. Stay well yourself. Thanks, Jeff.
Okay.
Bye-bye.
Good night. Dr. John Trowbridge, MD. And that was a very informative hour about the current state of proper stem cell therapy.